My name is Dan Heinemann, and I am a family doctor, a family physician. And I wanted to talk to you a little bit about my path and journey to get to where I had and the accomplishments I've had throughout my career. I grew up in Del Rapids. I grew up on a dairy farm. I always told people that my high school sport was cow milking because we had cows and cattle, and I needed to get up in the morning and be home after school to do the chores. So sports were difficult for me, so that was my sport. I tell people was very active though in high school. Graduated from a small St. Mary high school, 33 students in my graduating class. Then I went on to the University of South Dakota and got an undergraduate degree in biology. And it was probably in college that I gave some consideration to thinking about going into medicine. If you want to go to medical school and you think that's something you really want to do, you do have to have a pretty firm background in science. But I had music majors, I had architects, I had electricians, electrical engineers in my class. So it doesn't mean that you have to go and get a biology degree or a chemistry degree, but you do have to have a pretty good understanding of the basic sciences. So then I finished medical school, and I always told my friends who'd already been in the workforce for about 5 years when I finished medical school, that I had the most education you could have and still not be able to do much of anything. Because in order to practice medicine, you have to become licensed. And in order to be licensed, you have to complete what's called a residency. And so I did my family medicine residency here in Sioux Falls at the Center for Family Medicine. It was 3 years of kind of on-the-job training, if you will. And so I finished med school, went on into residency, finished residency, and elected to start a brand new practice in community of Canton, about 15 miles south of Sioux Falls, which now has been my home for 36 and a half years. And it's the place where I've lived the longest, if you will. My partner and I started a brand new practice, and in family medicine, and the family medicine was the love of my career choices. I mean, I couldn't find a better one. When I went through medical school for a while, I thought, when I was in surgery, I wanted to do surgery. When I was in obstetrics, I wanted to deliver babies. When I was in pediatrics, I wanted to take care of children. Well, in family medicine, I got to do all of that. I got to deliver babies. One of my favorite stories from practice was a Christmas morning. I wasn't on call that Christmas, but one of my patients who was going to have twins went into labor Christmas Eve, and we kind of put her in the local hospital hoping she'd stop going into labor because she was about 5 weeks early. So we went to the midnight mass and got back, and my wife and I were going to put together the kids' combination foosball, pool, and ping pong table. A lot of assembly was going to be required. So we were going to start that, and 5 minutes into that, I get a call from the hospital that my patient was going into labor. So I rode with her to Sioux Falls in the ambulance and got to participate in the birth of 2 beautiful little girls on Christmas morning. Came home exhausted to find my wife still working on the foosball table. Needless to say, we got it put together before the kids got up, but it was a nap for us most of the day on Christmas Day. But that's the fun part of being a physician. But I also remember a Christmas morning that I was on call, and I got a call at 9 o'clock in the morning from the hospital that one of my patients was presenting by the ambulance in a cardiac arrest. And by 9:30, somebody I'd taken care of for about 10 years had passed away. And so you can see that in medicine, and in like many specialties in medicine, but especially family medicine, you have tremendous joyful experiences, and you can have tremendous impactful, almost sorrowful, not necessarily sorrowful, but they hurt. You get attached to the people that you take care of. I went to a small town, and I want to tell you that I think one of the best places to practice medicine is a small town. Now, I don't consider Sioux Falls a huge city. It's bigger than Canton, but you get to know the people that you take care of, and you're taking care of your community. And that's what was really very appealing for me. And it was something I did and loved for 20 years. And then in 2000, 2001, I'd always been very active in organized medicine, and I'd been on some national boards of directors and of some national organizations. And in 2004, it wasn't that I was getting tired of practice, but I wanted another challenge. I wanted to try something different. I was used to impacting patients one patient at a time and impacting their lives one person at a time. And I saw through some of the work that I was doing nationally how you could have an impact with larger numbers and larger scale. And it was becoming very apparent with our healthcare system in this country that we needed some change. I'd seen what that change needed to be in my day-to-day work, and I wanted an opportunity to see if I could do that on a larger scale by working in an administrative position, maybe as a medical officer, working in advocacy, legislative events, and things of that nature. So I took the leap and was given a position at Sanford Health. At that time, I was Sioux Valley, or a health system here in South Dakota. And I became a medical officer, and I worked with 22 small rural hospitals and their physicians and the practices. And so I spent 16 years doing that and just had the good fortune of retiring from my active role as a administrative physician at Sanford Health this last July. As I reflect back on the 36 and a half years of working in medicine, 20 in active clinical practice, and then 16 in administration, what would I tell you that you need to think about in terms of where you want to be, what kind of doctor you wanted to maybe think about being, what skills do you have to have? And I look back, and as I said earlier, you need a really good foundation in science. Medicine is always going to be a science-based discipline. And another thing that I think would help a student going into medicine is really learning how to be a good communicator. I think when I first started in medicine, the doctor was kind of king or queen. And what the doctor said went. And if you came back and you saw your doctor after a follow-up visit and you weren't following through, it was almost kind of, you were ashamed because you had disappointed the doctor. Now we know that we need to engage patients better. I can be the best prescriber of diabetes medicines for my diabetic patient, but diabetes is a lifestyle disease, and it is that patient's disease. And unless I help that patient take the responsibility for that disease, neither of us are going to be very effective in managing that diabetes. So what I'm saying is I need to be almost a coach. I need to walk alongside my patient, not pulling or pushing them. I need to be a support for my patient and help them understand. So communicating the importance of that is really critical in becoming an effective physician, regardless of what specialty you're in. People will tell their doctor things they might not even tell their spouse. They will tell you things about their past that maybe their parents don't even know, or other people that are close to them that will know. So the other thing that I think is really important is you need to be trustworthy. And you need to be worthy of the trust that people are going to put in your hands, and cherish that. We are given a gift as physicians, a gift that we get to enter into people's lives at a level that very few other people get to enter into. So making sure that we respect that trust and gift is really very important. So again, that's a trustworthiness, I think. And those are not always things that are great. You can't put those on your application to medical school. But there are things that I think people can glean during your interviewing process for medical school when they see the things that you've done. Maybe you've worked as a nurse's aide in a nursing home. You volunteered at a senior center. You led a children's toy drive. You were a big brother or big sister to a student who is struggling in your schools, or worked at a homeless shelter or a food pantry. Those, I think, are things now that the folks interviewing for people going into medical school look for. And those are things that I always suggest. I just had a conversation with one of my neighbors last week. He's thinking about going to medical school, and he's worried about the money, and he was worried about the smarts, and he was worried about the length of time. And I said, "What's in your heart?" And he said, "Well, I really like working with people. You'll make it. It'll go really fast, and you'll figure out a way to pay for it when it's all said and done." So I have had some wonderful experiences, both in my work and in my work with Junior Achievement. And I want to continue to provide so much time as I can, and kind of maybe give some guidance to the next generation, because the people that are out there, the young people that are there, the doctors of the future are going to take care of me, and I want to make sure they're the right kind of people.